Hello students. So today we will going to discuss about antiemetic drugs. So first of all we have to understand what is emesis. So emesis is a protective reflex which is basically conducted by a vomiting center of our brain, that is medulla oblongata. So medulla oblongata can be stimulated by several ways. First, suppose a person smells some bad thing or having a bad psychological thought, can stimulate the cortex, and cortex ultimately stimulate the vomiting center, that is medulla oblongata, that leads to emesis. The second way of causing emesis is your GIT. If there is any GI irritant class of the drug or any drug that irritate your GIT mucosa, okay, that can release 5-HT, that is serotonin. Serotonin basically released from the enterochromaffin cells. So after the release of serotonin, serotonin can binds to the 5-HT3 receptor in the nucleus tractor solitarius, that is NTS, and this NTS can stimulate the your vomiting center. So next way is there is the stimulation of your CTZ, that is chemoreceptor trigger zone. Chemoreceptor trigger zone is a center that is present outside your blood brain barrier. Okay, so this can be stimulated by several chemotherapeutic agent or any cytotoxic drugs. So this CTZ having two type of receptor, that is serotonin receptor, dopamine D2 receptor and muscarinic receptor, and due to stimulation of this muscarinic and serotonin receptor, it also causes stimulation of your vomiting center, that can also leads to emesis. Okay, another way of causing emesis is motion sickness. You people might heard about motion sickness. So motion sickness is basically occurs when there is your vestibular changes, when there is any drugs that causes ototoxicity. Such type of drugs can cause disrupt your vestibule and stimulate your inner ear. Then from the inner ear the signal comes to your cerebellum, where from the cerebellum it goes to the vomiting center, and that leads to vomiting. So when the vomiting occurs, what are the changes occurs in your anatomical structure? So anatomical structure, that the changes that occurs in your anatomical structure is, first one is relaxation of your lower esophageal sphincter. Okay, then second one is contraction of your diaphragm and abdominal muscles, increase in intra-abdominal pressure, and closures of your epiglottis. And you know that epiglottis is a structure which basically prevent the entry of any drugs to the respiratory as well as GIT tract. So this is the way how the emesis takes place. So let us talks about that what are the drugs that can stop emesis. So as I told you that there are involvement of histaminic receptor, there is a involvement of your muscarinic receptor, there is a involvement of your dopaminic receptor, serotonic receptor as well as NK receptors. So we can antagonize this receptor to treat such type of disease conditions. So first one is anticholinergic drugs. So anticholinergic drugs like promethazine, cinnarizine, diphenhydramine, meclazine, such type of drugs can be used. Then second one is antihistaminic class, those drugs that I have discussed right now, these are antihistaminic drugs. So in case of anticholinergic drugs are dicyclomine and hyoscine. Okay, this type of drug basically given during motion sickness. I told you that during the motion sickness is basically occurs due to disturbance in your vestibular system. Okay, third class is serotonic antagonistic receptor, that is 5-HT3 antagonist. So 5-HT3 is a ion channel receptor. The drug that antagonize these receptors are your ondansetron class of the drug, ondansetron, pyrrolositron class of the drug. Next class of the drug is your prokinetics drug. So prokinetics drugs are basically act by agonistic action on your 5-HT4 receptor. So 5-HT4, when this drug basically binds to the 5-HT4 receptor, they basically increase your peristalsis. So that can also helps to prevent the emesis process. So drugs comes under this class is metoclopramide and cisapride. Okay. and domperidone also. Then next class is your neuroleptics. Neuroleptics are that basically blocks your dopamine D2 receptors. So these are drugs like haloperidol, trifluperazine and chlorpromazine class of the drugs. Then NK receptor antagonist are aprepitant and fospiritant. Then another class is additional adjuvant class of the drug, which basically we can give in to combination with other drugs like dexamethasone, the corticosteroids, and dorendiol is a cannabinoid receptor antagonistic agent, that is CB1 antagonistic agent. So there are one kind of emesis that you people might have heard about, morning sickness. So morning sickness is basically seen in the early stages of pregnancy. Early stages of pregnancy में basically seen करता है. So drugs that can given in case of morning sickness is your promethazine plus vitamin B6, that is pyridoxine. This is the safest antiemetic drug that can given during this class. Okay, so the drug that I have discussed with you, that is 5-HT3 antagonist. 5-HT3 antagonist class of the drugs basically given in chemotherapy induced vomiting. As you know that most of the anti-cancer drugs are highly emetics or highly emetic in nature. So one of such class of drug is cisplatin. Cisplatin is a platinum compound which is considered as having highest emetic property. Okay, so to treat this cisplatin induced vomiting, we have two class of the drug. So cisplatin induced vomiting basically occurs in early onset type and delayed type. Early onset is basically occurs within the 24 hours after the treatment, and delayed type is occur after 2 days. So in case of early onset of type cases, we can give 5-HT3 antagonist, that is ondansetron class of the drug, or in case of delayed type of vomiting, we can give NK1 antagonist, that is aprepitant class of drugs. Okay, next is dexamethasone. Dexamethasone is also given in case of chemotherapy induced vomiting, and dorenbiol is a CB1 receptor stimulant, basically stimulate the CB1 receptor, which also having increases your appetite. It also having appetite stimulant property as well as anti-emetic property. That's all about anti-emetic class of the drug. Thank you.